Most common in older women with osteoporosis, their brittle bones create a perfect setup for a compression fracture.
And the problem that occurs is you lose the height of that bone. It swells, it becomes very painful.
Unlike a standard break you might experience in a long bone, like an arm or leg, our spine is somewhat spongy. As bone thins, even the smallest movement can collapse or compress the area.
It can lead to scoliosis if it rotates. If it's really unstable, it can create fragments back towards the spine.
A fracture will typically heal on its own in a matter of months, but not necessarily in the proper position. Patients may be left with a deformed spine that gives them chronic pain, but a minimally invasive treatment called kyphoplasty is expanding their options, using a balloon to fix the fracture from the inside.
The procedure itself is really geared towards actually expanding the vertebrae back as much as possible with a balloon, and then putting the cement in to stabilize it. So what you want to do is you fill in the vacuum where that weakened bone is.
The kyphoplasty balloon is inserted through a needle while patients are under local anesthesia or sedated.
You numb it up, you go in, and you can actually expand the vertebrae. There's newer cements now that actually help to regrow some of the bone around it.
The spine now stabilized. Many patients feel better almost immediately.
Some people even feel better when you get them off the table and put them back in the recovery area. That's how quick.
Thanks to an expanding treatment option that takes the pressure off their spine. For Lee Memorial Health System, I'm Amy Osher.